Bit of news out of Merck in the last hour. They are developing a COVID-19 antiviral pill. They say it reduced the risk of hospitalization or death by 50% in an interim analysis of a late-stage trial, Tom. So some decent news, according to Merck.
I'm lost on this. Let's go to an adult. Andrew Pekosz joins us with Johns Hopkins Bloomberg School of Public Health. Andy, let me cut to the chase. When I see a scientific statistic that it's 50-50, I'm not going to die from a pill, I'm not sure that's science. What is the efficacious nature of any form of medicine where I got a 50% outcome?
Well, it can be incredibly important, particularly if you're thinking about populations that are vulnerable and may have a high likelihood of having disease. And I think that's where antivirals really start. They're another tool in the arsenal to fight back severe COVID-19.
Yeah.
And taking it early, and this is the critical thing about antivirals, you have to identify this early, and that's why I think targeting antivirals to vulnerable populations makes a lot of sense.
Yeah.
If you are over 65, if you have a medical condition that predisposes you to severe COVID-19, if you get that positive COVID-19 test, you want to start getting an antiviral right away to change the course of the disease.
That's what Dr. Abramowitz says. Lisa?
Well, honestly, it's interesting to me, the idea here of keeping people out of the hospital. It's got a 50% chance of either keeping people out of the hospital or reducing death. The idea here, Andy, is how much is the fight against COVID a fight to keep people out of a hospital so that you don't have the strain on the healthcare system, and then we can treat this like the common cold?
I think that really is the first and most important goal. We want to protect lives. We want to prevent disease. We don't want to stress the healthcare system so that we particularly see these ripple effects, right? Where when we have these COVID-19 outbreaks that stress the hospital system, other diseases, people coming in for other types of care suffer because the hospital resources are strained so thin. So you want to keep people out of the hospital. You want to reduce disease severity. And then on top of that, if you can reduce the number of cases and transmission, then you've got extra benefits in terms of controlling the disease.
Well, so Andy, to Tom's point, this whole 50% idea, it's not a sure thing. It's not going to be enough to basically end the pandemic as we know it. What would be? What are you looking for in terms of a treatment, which we have not yet seen, that could potentially be a game changer?
Well, right now, antivirals with 50% efficacy add one more layer to your protection. So if you go out and get the vaccine, if you practice some social distancing when you're in high-risk situations, and you now have an antiviral available, you now have 3 levels of protection, which cumulatively will reduce the number of severe cases in a much higher, in an exponential way than any one of them individually. So that's the first thing that you have to think about. Antivirals are always a little bit difficult because the earlier you treat, the better off you'll be. And with so many asymptomatic infections and with symptoms sometimes progressing very quickly, the timing of the antiviral can often be hard to administer to get a really high efficacy in terms of preventing disease. But it's a tool in the arsenal, and added together with the other things we have can really help us control severe disease.
Dr. Pekosz, we see a lot of mask wearing in places where the vaccination rate is 84% or 88%. Indeed, maybe up to 90% as well. In America, is the wearing of masks in high vaccinated areas good science, or is it emotion?
I think it doesn't hurt. I think what's important to know is what your infection rate is in that part of the country. Vaccination rates are great, but it's really about exposure to virus. And if you are in a part of the country where high numbers of cases are occurring, even unvaccinated people, your potential to be exposed to the virus is higher, and therefore having something else in place besides the vaccine to protect you is a good thing to do. Mask wearing in and of itself has to be combined with other things to really be effective.
I look at this, Andy, into the weekend. I see in the United Kingdom they're talking about flu season, about the idea of a flu shot literally being taken at the same time is a booster shot, or I guess a vaccination as well. How does your work on COVID overlay on the flu season?
Well, 2 years ago, my laboratory was completely focused on influenza and dealing with that. And this year, we're gearing up again to start monitoring for influenza because all signs early in the season indicate that flu is probably going to come back this year. And because we've seen few cases, few infections. We expect to see a burst of flu, particularly
Oh,
in children
interesting.
who have the least amount of immunity to influenza. So we're gearing up to
So,
to control for that and test for that as well.
Andy, I always notice the stuffed virus is behind your shoulder there. Have you switched it from COVID to flu? Is that what I see?
They're right next to each other there because I think both of those things are now going to be important to remind people about. Respiratory viruses in general cause a huge amount of disease in the population, and both of those vaccines are ways to control that.